So we're now going to move on to another oral abstract presentation session, this time on complications of the end stage of liver disease. The first speaker is going to be from Egypt. It's Hassana, who's going to speak about DNA methyltransferases as a potential biomarker for hepatitis C related hepatocellular carcinoma.
DNA methyltransferases as potential biomarkers of HCV-related hepatocellular carcinoma. Hepatocellular carcinoma is a universal health problem. It represents 6th most common cancer in women and 2nd most common cancer in men in Egypt. Increased incidence of hepatocellular carcinoma in Egypt is due to high prevalence and complications of the hepatitis C virus infection. Epigenetic factors result in abnormal expression of genes without changes in primary nucleic acid sequence. DNA apparent methylation is one of the epigenetic factors that plays an important role in cancer development. Hypermethylation of promoter CpG leads to gene silencing of tumor suppressor genes that play important role in molecular pathways of carcinogenesis. DNA methylation is mediated by a group of enzymes, including the DNA methyltransferases family. DNA methyltransferase A and DNA methyltransferase B mediate de novo methylation, while DNA methyltransferase 1 function mainly to preserve pre-existing methylation. The aim of this study was to evaluate the expression of DNA methyltransferase 1, 3A, and 3B in peripheral blood as non-invasive diagnostic markers for discrimination of HCC among chronic HCV patients. It was a case control study, included 91 patients classified into 3 groups: chronic HCV patients with cirrhosis, and chronic HCV patients without cirrhosis, and HCV-related HCC patients, in addition to 20 apparently healthy individuals ruled as control group. For any patient found to have focal lesion in the liver by abdominal ultrasonography, diagnosis of hepatocellular carcinoma was confirmed by characteristic radiological pattern detected by multi-slice triphasic spiral CT scan, MRI, or liver biopsy if needed. Quantitative real-time PCR was performed to evaluate DNA methyltransferase 1, 3A, and 3B messenger RNA in peripheral blood samples of all participants. The results of the study showed that expression of DNA methyltransferases 1, 3A, and 3B show highly significant increase in HCC patients compared with control and chronic HCV patients. Log curve was done to assess the diagnostic performance of DNA methyltransferases for HCC within cirrhotic patients. Analysis of log curve show a highly significant diagnostic performance of DNA methyltransferases for HCC detection within cirrhotic patients with cutoff value of 0.65, 3.16, 3.1, with accuracy of 68.4, 88.2, and 81.2 for GNMT1, GNMT3A, and GNMT3B respectively. This shows us that DNMT3A represents the best diagnostic marker among the studied GNMT. Also, it was a significant highly expression of GNMT1, 3A, and 3B associated with the presence of multiple focal lesions compared to the presence of single focal lesion in the liver. Conclusion, DNA methyltransferases could be potential biomarkers for early detection of hepatocellular carcinoma development in cirrhotic HCV patients. Apparent DNA methyltransferases expression is suggested to have a major role in hepatocarcinogenesis in patients with chronic HCV infection. This justifies the promising role of DNA methyltransferases inhibitors in treatment of HCC patients. Further evaluation on a large group of patients could pave the way for clinical application. Thank you.
Thank you. Move on to the next speaker, who's Ibrahim Diallo from Senegal, and they are going to present on hepatocellular carcinoma in Senegal, the epidemiological, clinical, and etiological aspects in a large number of patients in their hospital.
Thank you very much to give me the opportunity to talk about hepatocellular carcinoma in Senegal. As you know, hepatocellular carcinoma is the most common primary liver tumor and represents a real public health problem in our country. It is the second leading cause of cancer in men and the third in women, with hepatitis B as a main risk factor. HCC is a tumor with a very poor prognosis, particularly in resource-poor countries. The aim of our study is to describe the characteristics of HCC at Hospital Principal of Dakar. This is a retrospective and descriptive study including all patients hospitalized for HCC in 6 years. The diagnosis of HCC was based on one of the following three criteria: histological evidence of HCC, combination of two morphological aspects of HCC, or morphological criterion associated with an increase in the level of the alpha photoprotein greater than 400 nanogram per milliliter. We included 229 patients with mean age of 47 years. Among them, 33% were under 40 years of age. The male to female ratio was 6.6. Among our patients, some of them reported a chronic carrier of hepatitis B virus in the family or a chronic history of liver disease in a first degree relative, and 10 patients were on treatment with nucleotide analogs. On clinical characteristics, at diagnosis, the performance status of HBV was bad in 48% of cases. The clinical signs were dominated by abdominal pain, which was found in 210 patients, and hepatomegaly in 170 cases. Biological tests showed that liver function test was altered in the majority of patients with stenosis in 93% of cases, cholestasis, and low prothrombin time. 68% of patients had a value of alpha protein greater than 400 nanogram per milliliter, but 28 patients, 11%, had normal alpha photoprotein level. On imaging, abdominal ultrasound showed nodular lesion of the liver compatible with HCC in 68% of cases, with an average size of the nodular lesion at 6.5 centimeters. An infiltrative form of HCC was found in 19 patients, and abdominal ultrasound didn't find a lesion compatible with HCC in 38 cases. CT scan was also performed and showed lesion compatible with HCC in 88% of cases. The diagnostic strategy for HCC in our patient was based on a high level of alpha photoprotein in 68% of cases associated with abdominal ultrasound, abdominal CT scan, or MRI. For patients with an alpha photoprotein level below 400 nanogram per milliliter, the diagnosis of HCC was based on ultrasound with MRI and or CT scan, a CT scan associated with MRI, or a CT scan alone. The most common cause of HCC was HBV infection. It was found in 69% of patients. However, 21% of patients, no risk factor was found. It should be noted that the investigation were not exhaustive in these cases. Childhood classification showed that patients were childhood B in the majority of cases. According to the Benson stage, around 95% of patients were in advanced or terminal stage. A curative treatment was done in 12 patients and a palliative treatment in 7 patients. The other patients had just symptomatic treatment. The outcome was favorable in 6 patients. These results inspired some comments. Senegal is located in the endemic area of HBV with a high prevalence of HCC. A decrease in the incidence is noted in 40 years, but the situation didn't really reflect the reality in our region. Because of under-medicalization, many cases are not diagnosed or reported. HCC in Senegal is a disease of young adults with a clear male predominance. Senegal is an area of a high HBV endemicity, and infection occurs at a very young age. The data are similar to the results found in the various studies conducted in sub-Saharan Africa. The diagnosis is done at late stage, and as in the studies reported in sub-Saharan Africa. This late stage is also reflected by imaging. The average tumor size of HCC at diagnostic is greater than in developed countries. And using BCLC staging, around 95% of patients are in advanced or terminal stage in our country, but also in sub-Saharan Africa. This reflects also a lack of screening program for people at risk. Alpha photoprotein is also an important element for the diagnosis in our country. It is available in most health facilities, and combined with ultrasound can do the diagnosis in around 70% of cases in Africa. Significant proportion of HCC without risk factor is found in our study, as in sub-Saharan countries. This may reflect the lack of exhaustive etiological investigation due to the lack of resource. In conclusion, HCC is a condition that mainly affects middle-aged adults with a clear predominance among men in Senegal. Diagnosis at advanced stage, and the main risk factor remains HBV infection. The prognosis is very poor, and it is why it is necessary to do prevention by improving awareness of HBV vaccination, screening for chronic HBV infection, and implementation of HCC screening program for patients at risk. Thank you very much.
The final speaker in this session is Edward Sincarla from Zambia, who's going to present on propranolol reducing portal vein diameter in schistosomal liver disease with portal hypertension.
Right, thank you very much for giving me this chance to present our findings. This is propranolol reduces portal vein diameter in schistosomal liver disease with patients with portal hypertension. There's nothing to disclose. And this is the layout of my presentation. So hepatosplenic schistosomiasis is a leading cause of portal hypertension in the tropics. But we know that cirrhosis dominates in the Western world. And we know that Schistosoma mansoni is the commonest cause of portal hypertension in Zambia. And this is acquired through repeated contact with water bodies, like you can see this chart. And one other thing is that it's the seroprevalence can be as high as 88% in the western parts of Zambia. Morbidity and mortality actually is attributed mainly to the varices that are as a result of portal hypertension in this patient. As you can see, the varices are bleeding, and this can be actually life-threatening. The Wenreb and others were in 1982 actually noted that the portal vein diameter is associated with biracial bleeding. And we all know that beta blockers are very effective in preventing, in the primary prevention of biracial bleeding, as well as secondary prevention of biracial bleeding. However, it's not clear whether beta blockers such as propranolol have any effect on the portal vein diameter. We therefore set out to explore the effect of propranolol on portal vein diameter in patients with lysosomal liver disease. So in terms of methods, this was an observation cohort done at the University Teaching Hospital in Lusaka, Zambia. It was actually an extension of rifaximin clinical trial. Okay, we actually randomized 85 patients to either rifaximin and standard care. Standard care in this instance was propranolol, or just standard care on its own for 42 days. We thereafter followed these patients for 180 days. We measured the portal vein diameter using ultrasound at baseline and at day 180. Our main primary outcome was the change in portal vein diameter, whereas beta blockade and reduction in splenic size were the secondary outcomes. So, coming to the results. Before we go to the results, the methods, also in terms of inclusion criteria, hematemesis was one of the criteria we used to include patients, varices on ultrasound, periportal fibrosis, and serology for schistosomiasis. These were the main, inclusion criteria. We excluded patients who had HIV, Hep C, and hepatitis B, and whose ultrasound was suggestive of cirrhosis. Of course, those that were unable to give consent were excluded. So we evaluated 186 patients and randomized 85 in rifaximin arm as well as non-rifaximin arm, followed up for 42 in the clinical trial, 42 days in the clinical trial. And after the clinical trial, we followed up these patients on propranolol for 180 days. And the patients that completed the follow-up were actually 66. We then looked at the baseline characteristics. They were not different in the rifaximin arm as well as in the non-rifaximin arm. But one thing to note is that there was profound low platelet count, HB was quite low, and the splenic size was actually higher in all the groups of the patients. Portal vein diameter, we noted that it reduced after 180 days, and this was quite significant. And this can be attributable to propranolol, like I said. We also noted that beta blockade was quite effective, and we know that the pulse rate, the radial pulse, actually went down after 180 days, which is attributable to beta blockade. We also noted that the hemoglobin went up, and this is because of the low episodes of bleeding, and the splenic size remained unchanged after 180 days. How then do we conclude? So we are saying propranolol led to the reduction of portal vein diameter over 180 days. And this therefore suggests that ultrasound could be very useful in monitoring the compliance of beta blockers in patients with schistosomal liver disease. Ultrasound here could be very useful in resource settings like ours where portal hypertension measurements are not readily available. It would also be very, very helpful if we could establish that portal vein diameter can be used to predict episodes of variceal bleeding in hepatosplenic schistosomiasis. I'd like to thank the funders, the Wellcome Trust, as well as the SACO. Thank you.
So that's the end of the session. Thank you very much to all of the speakers who presented fantastically. We're now going to have a short break before we have our next oral abstract presentation session. Please go back to the timeline, and if you go into the next oral abstract presentation session, after this you will be able to meet with the presenters and then ask them all of the questions which I'm sure you have from the interesting sessions we're having.